Hello guys, and welcome back to my channel. And today we are going to talk about something that is very near and dear to my heart. Sorry for the clickbait title, but hear me out. Don't come for me just yet. I'm going to tell you why all nurses should go to AA, and not because we're all alcoholics. Let's just get into it, okay? All right, so first we're going to All right, so one of the main things in AA and Al-Anon, which is AA for families and friends of alcoholics and addicts, is that there's like these slogans that they call them. And it's pretty much just like cliche phrases that we all love and they get you through your day or whatever. But I'm going to show you how you can apply AA and Al-Anon principles to your nursing practice, and not just with dealing with alcoholic or addict patients, but with all patients and pretty much any situation that you might come across, whether it be with a coworker or another physician or whatever it might be, your family. That's a big one. So let's get into it. All right, some of the top slogans are like real short, like, let go and let God, think, keep it simple, one day at a time is one of the big ones, things like that. So, AA is a faith-based organization, so if you have a religion that you go to, you can always apply it to that as well. I'm not particularly religious, so I just, my higher power is just kind of like the universe. Just turn it over to whoever you want to give your sorrows to, and they'll handle it. So one of the big ones with AA is one day at a time. So when you have 3 in a row and you're on your first one and it is not going smoothly, thinking about, well, I have to come back 2 more days from now and I have to do this again and again after that and I have to keep doing this, whatever. Just focus on that shift and then go home and sleep, and then hopefully the next one will be better, and then you can start focusing on ways to make the shift that you're in right now better instead of worrying about what's going to come in the future. That might seem a little obvious, but it'll make more sense, I swear. Another one that I love to apply to my own personal life is live and let live, because sometimes in even my personal life I can get caught up in what's going on with one of my friends or another family member or a patient or a coworker, and it just focus on what they're doing and like not let them just live their life. And when a patient comes in and they don't want treatment for their cancer, or they don't want to comply with their medications and it's causing them bodily harm, it's their choice. Live and let live. You unfortunately can't change their mind. All we can do is educate and hope that we can give them a different perspective that might change their outlook. But if they choose not to, you just have to let them, you can't carry it home with you every night and come home and say, my patient in 250 didn't want to take his diabetes medication, so he's going to go home and die, and you have to carry that with you. All that you can do is do your best to educate, do your best to document, and that's a big one, and then leave it at that. Live and let live. Another one that's not as well known that I really enjoy is let it begin with me. So when if I see something that is not being performed correctly, or if there's something that I feel can be improved, let it begin with me. Let it begin with me documenting properly and detailed and however else. And let it begin with me questioning something that's been continued for the past couple shifts. And instead of just saying, well, it's been going on this couple shifts, it's good, let me be the one to question it. And if, whomever I question it says, I see your point, that's good, or I see your point, let's make some changes. Let it begin with me, let it begin with you, and making better outcomes for your patient by always questioning and always having a questioning eye and wondering, is this the proper thing? Because I can tell you, when I'm handing off a report, a nurse will ask me, well, why is she having this? And I'll say, well, I don't know. And then I'll think back my shift, I'm like, why did I just accept this and not be like, why is she having this test? I don't know. But there's a reason, of course, but I just didn't think to question that. So always have a questioning mind and let it begin with you, let it begin with me. Okay, the last slogan that I want to mention is having an attitude of gratitude. There's a big event in most areas with a big AA Al-Anon population called Gratitude Night, and that I've been to a couple and I really enjoyed them. It's, people giving their testimonies and saying like, I'm just thankful for what AA or what Al-Anon has brought to me. And Al-Anon, I've been going for 5 years, and Al-Anon has brought me such peace with my own personal situations, but also with how I react to issues that are happening in my, professional life. A patient can be, the most nasty, rude, condescending, demanding as they can possibly be. And I can look at them through this lens of Al-Anon and say, you are going through something terrible, and I'm here to help you. And it is difficult to constantly be berated by a patient, and you're like, I'm here to help you, stop treating me like crap. But they are going through something that's so stressful. It could be a brand new illness, or it could be exacerbation of a chronic illness. They thought they had it under control, and all of a sudden they are so sick again. So there's lots of issues that compound when a person's admitted. And also, we pretty much take away all of their rights, including the right to pee. They have to call if they want to pee. They have to call if they want to eat. They have to call if they want to roll over sometimes, So we've taken away a lot of their independence and a lot of their rights in the hospital, and that can be very stressful. So as I've said, I've been in Al-Anon for 5 years, and with the growth that I've had within Al-Anon, I look at every patient as if they are an alcoholic. And I know that sounds super weird, but an alcoholic or an addict is someone who is obviously going through something because they are using alcohol to cope with it, or drugs. They are extremely, extremely selfish, and that's across the board with all addicts and alcoholics. They are just selfish people because they're using that alcoholism to cope with whatever they're going on. They project onto you what their problem is, what their insecurities are. They are only worried about themselves. Alcoholics and addicts are not creative, and they're not unique. So this is how they all act. And if you know anybody who is an addict or alcoholic, you will see this. So when I say that I treat all patients like they're addicts, they are in a place where they're unhealthy and they're afraid. Therefore, they become extremely self-centered and very selfish. And I'm not saying that's wrong. I am just saying that I understand where they're coming from. So if you expect a patient to be fearful and selfish and self-centered and worried about what's going on with them and not about what's going on with everybody else, they don't give a crap about anybody else except for them, because their health is at stake. So when you know that the patient's going to act this way or feel that way, then you can better prepare on how you react to when they are, having an outburst or whatever's going on with them. And I do want to say a disclaimer, not all of my patients are nasty and rude. Very few of my patients are mean. But if you have an understanding of how they might be feeling, then you can better care for them, and it's not going to cloud you in any way. You're not going to say, oh, well, they're fine, like they're not really feeling any, this is just normal, whatever, just a day. They are still very fearful and very self-centered and very selfish about what's going on with them. They're just not expressing it in an angry or selfish, rude way, So, the merry-go-round is a term that we use to describe a never-ending cycle of crazy, pretty much. And I know crazy is kind of a buzzword. Maybe you shouldn't really say that. A never-ending cycle of unhealthy behavior. How's that? So, the addict or alcoholic is one piece of the merry-go-round, and the person who enables them is another piece, and a person who's their spouse and is in complete denial is another piece, and there's many pieces that make this sucker go around, and it never ends. And in order for, if you are one of those pieces, maybe you're the enabler of an alcoholic in your family, and you want to get off the merry-go-round, you have to stop enabling them. So it helps you grow in that way. But when you apply it to healthcare and nursing, you have to get off the merry-go-round of a family dynamic. You know, there could be a mother who brings in her son who, you know, happens to be an addict and has relapsed, and she is in such denial. She's like, this is not a relapse. We are not relapsing. This is just a whatever. This is just a slip. This is not a relapse. But if you work in, you know, mental health or in emergency medicine and they come in with an overdose, you say, well, that's a relapse. But, you know, call it whatever you want. So the family is in denial of what's going on with the patient. The family is enabling him with whatever's going on with him. Another great example, diabetics. They often have extreme enablers and people who are in extreme denial, and they are probably in denial themselves if they don't educate themselves and don't learn how to manage their diabetes. So, my favorite thing of all time is when I'm drawing up insulin for my patient with a sugar of 250 and the family brings in McDonald's. What are you doing? They're here, admitted for this issue, and they have a special diet that we're giving them. Stop bringing them food. Yeah, so the family is obviously in denial of his actual condition, and they're obviously enabling him by bringing him more food. If that's not the most frustrating thing, I don't know what is. So, by not getting on the merry-go-round of the family is like arguing with them or, you know, letting it happen or not educating. All you have to do is try to stop this merry-go-round that the family is on, is to just educate and step back. And this can be difficult and it can be touchy, and some people are really territorial when it comes to their food. I can understand that. So if I am stuck in this hospital bed, I'm eating crappy food, and I'm just hungry for a cheeseburger, and my family brings it to me, I'm so happy. And then the nurse is like, well, you really shouldn't be eating that. I'm going to be like, get up off me. I don't care. Like, just give me another dose of insulin. I don't care. And I can see where a family and a patient might think that way, because I think a lot of people who don't have a good grasp of how diabetes affects their body just says, you know, well, if I eat an extra cheeseburger, just give me an extra dose of insulin, and that's just how it works. Which, I suppose if you don't want to live very long, you could do that, but that's everyone's choice, and that's why we live and let live, because we can just let people make their own choices and move on. So, the final thing that I want to mention on how alcoholics resemble patients is that we do not have to accept unacceptable behavior, and we have the right to set boundaries. This is a huge, huge thing in healthcare, especially with patients assaulting healthcare workers. This happens all the time, especially in emergency and psychiatric facilities, but even on, you know, a simple med-surg floor where I work, I've been smacked by a patient. And just because they're, you know, having dementia or whatever, it doesn't mean I have to accept getting smacked. So there's lots of things that are defined under unacceptable behavior. Obviously, getting assaulted is the top one. Verbal abuse, manipulating me, emotional abuse, screaming and yelling for no reason, throwing things. There's lots of ways that patients act out because either they have, you know, a mental disorder, or they are so afraid of what's happening to them and they're being so selfish and self-centered, coming back to what, you know, alcoholics and addicts are all about. They have no idea how to express their feelings. They have no idea how to say what they want. They have no idea how to ask questions. They don't understand. They're afraid. So when a patient's acting out like this, it doesn't mean that just because they're afraid, you have to accept all these things, being hit, being smacked, being yelled at, being screamed at. And this is another place where we set boundaries. You know, a patient could be screaming in my face over something so minor and say, you're not going to yell at me. I'm here to take care of you, and I will gladly help you in any possible way that I can, but I'm not going to be yelled at. If you want help, you have to ask. If you want help, you have to say what you need, and I will gladly do it. And that's a boundary right there. I'm not going to be yelled at. And if you continue to yell at me, I'm going to, pull in my charge nurse, pull in my supervisor, go from there, because I'm not going to be yelled at. You're going through a tough time, and I'm here to help you. You're not going to treat me like that. And that is my number one boundary, is I'm not going to be treated like crap. When we let this stuff go and go and go, and sometimes a lot of us don't have the support when it comes to patients assaulting us verbally, emotionally, physically, whatever. I think in my particular hospital, I think I have great support, and I'm so thankful for that, but not everyone has that. So I think that you need to set your boundaries on what you are willing to accept. And if they go past those boundaries, then you take action in whatever way that you can. And if you don't have the backing, you just have to do the best that you can, because your safety is number one and the patient's safety is number two. But I'm not gonna get hit on the side of the head with a water cup because you're afraid of what's going on with you. I won't, So I hope that you really enjoyed this video. Take everything that I said with a grain of salt. This is just my opinion. This doesn't reflect my employer's opinion. This is just me speculating on how what I've learned in Al-Anon and AA reflects onto my practice. I hope you guys really enjoyed it. Hit the subscribe button if you loved it and want to see more, and I hope to see you guys in the next one. Bye.